You want to test some mics?
Sure.
All right.
Test.
Test. Look what I did. You're gonna look at it and you're gonna like it.
I am Testicles from the island of Pinos.
Look, I know this means nothing to you. It's kind of a tough shit situation though. Hold on. All that
Ready? Do you have topics?
Yep.
Okay.
Hey, Doctor. It's Chris from Sugarloaf, Maine. Quick question. I've been on Advair for several years.
right, here we go. Now, everybody, get ready for a real hootenanny.
Does this have to be a full 45 minutes?
You can leave anytime.
With Dr. Steve. I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I think.
Dr. Steve!
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred with the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
What's up?
This is, wow. This is a show for people who never listened to a medical show on the radio. If you have a question, Tacey's appealing to the kids, man. She's down with the lingo.
Yeah.
She goes, hey, let me ask you a question. And they go, what, man? And she goes, what's up?
No, I said sup.
Okay, all right. What do I know? Give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we're not your medical providers. Take everything you hear with a grain of salt and act on anything you hear on the show without talking it over with your nurse, practitioner, doctor, physician, assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. Very good. Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. Everything going okay over there?
Oh, yeah.
We are recording this in September 12th, as a matter of fact, of 2023, and it is officially allergy season.
Yes,
There's grasses and ragweed and
Gosh.
stupid crap out there. And, check out Dr. Scott's website. He's got a possible solution for you. I can't actually... Whoa, nice. That was my fault. Can't actually advertise anything on here, but check out Dr. Scott's website at simplyherbals.net. Maybe you'll say a thing or two that might help you.
Vikings.
Anyway, all right. Last time we did kind of a fun thing. I think it was fun. We went back to voicemails that we've never answered from 2014 and found out that people had some shit going on 10 years ago that we never got to, so hopefully they're okay. Maybe we'll get some feedback. So I thought we'd do some more of that today. But before that, I think it is time for...
It's Tacey's time of topics. A time for Tacey to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey.
Tacey wishes she was on a show called Tacey in Paris.
Yeah. Tacey
Okay.
in Paris or Tacey in a room that has air conditioning.
Hello, everyone.
You know, we're trying to work on that. We're going to move the studio, but then Tacey was like, no, I like it up in, it's like, okay, we
Well,
can't.
okay, nobody turned the air condition on, so that's not a fair argument. Okay, so topic 1. Hello, everyone. Scientists grow human kidneys
Topic number
inside
2.
pigs using stem cells.
Oh, yeah.
A team of Chinese researchers has successfully grown early-stage developing human kidneys into female pigs using chimeric embryos.
Yeah.
This is the first
Wait,
time.
true chimeric embryos? I mean, are they chimeric in the sense that they're half pig, half human?
If I can read on.
Oh.
This is the first time a solid human organ has been grown inside an animal species other than human.
Yes.
And this was in Interesting Engineering. This is also from Stacy What's-His-Face.
Okay.
Unlike normal embryos, chimeric embryos contain cells or tissues from 2 different organisms.
And what are the 2 organisms?
In this case, the researchers used human and pig cells.
Wow. So these are true hybrids?
Sounds like an X-File.
I mean, I reckon so.
Oh my God, we're
that
going
wild?
to be overrun by pig men
Okay, so
or man pigs.
let me
we
read
already
on.
have those. Okay.
The researchers claim that the embryos underwent normal development inside pigs for 28 days. During this period, they noticed the formation of tubules and some other renal structures in the developing kidney.
What?
The study demonstrates proof of principle of the possibility of producing a humanized organ.
Okay, so they have the pigs are chimeric, or the embryos were chimeric.
Well, I was the embryos were, the pigs were
The
chimeric.
pigs are. So the pigs are raised with human and pig DNA. I'll temporize while you look for that.
I'm not looking for it.
Oh, you're just looking.
just
you're
reading.
just looking down at
I'm
the
just
thing.
reading.
Okay. I'm just very curious because they just raised some embryos and saw that the embryos made kidney tubules and then just aborted them.
The question I was going to
The
ask
question
you,
is,
Steve,
yeah.
is what a chimeric pig is. So you cannot ask me any questions beyond that.
Yeah, no. Okay, so you said it. Chimera are in mythology it was a mixture of two different animals, right? It'd be like what? But
It
had
says,
wings
in this
and
case,
a
the
lion with
researchers-
a man and a unicorn or something.
It says the researchers used human and pig cells to create the chimeric embryos. So it was a mixture of both.
Oh, boy. Yeah, there's a whole thing about moral uncertainty and the farming of human pig chimeras. So this is from National Library of Medicine. This is from the Journal of Medical Ethics in 2019. They were worried about this. They said it may soon be possible to generate human organs inside of human pig chimeras via a process called interspecies blastocyst complementation.
Well, let me continue reading.
Oh, there's more. Okay.
And you can comment
Yeah.
as,
Go ahead.
as you feel
Well, thank you.
obliged. In the past, scientists have used a similar process to produce human tissue and muscles inside pigs. However, they couldn't grow an entire organ because successfully incorporating human stem cells with pig cells is very tricky.
Yeah.
For instance, pig cells tend to be more successful or dominant in such embryos because they multiply more rapidly than human cells. This competition can make it challenging for the human cells to survive and develop within the pig embryo. Wow. Also, human and pig cells require different nutrients, environmental conditions, or signaling molecules to grow. So they employed three techniques to overcome these challenges. First, they used CRISPR to eliminate two genes
Right.
in pig cells.
CRISPR's basically a gene editing
Yeah.
system.
That's required for pig kidney development. This ensured the growth of only human kidneys. Second, they ensured and used human
Well, even you cook
pluripotent stem cells in the
bacon in
chimeric embryo.
bacon in lard, it'll make it hit
These cells
CRISPR.
can renew,
It
grow, and
shortly
divide
will.
into any type of human cells.
It'll make
Third,
anything
they created
CRISPR.
an optimized environment for the embryo to accommodate the distinct needs of both human and pig cells. This environment ensured that each cell could receive the nutrients and molecules best suited for their growth.
They must have had plenty of mud in there to accommodate them pig cells, don't you know?
Okay, so they created 1,820 chimeric embryos.
Right. So the mother is an actual pig. The embryo is chimeric, which it makes me feel a little bit better that they don't actually have adult pig-human chimera running around.
And they only used
we know
13
of.
surrogate pig mothers.
Don't-
And they only
don't call 'em
examined
that.
5 embryos.
You bunch of pig mothers.
That's what they called them.
I know.
When they examined 5 embryos after 28 days, they found that they had grown into mesoniferous, early-stage human kidneys with tubules and cell growths forming the ureter.
Okay, so the thing is that where the ethics is going to come into this is because they're going to make embryos inside these surrogate pig moms, and they have some human DNA and some pig DNA. First off, if you grow one all the way to the end, I don't think it will grow.
No.
I think that what Tacey was alluding to is that, the pig cells want to develop faster because pig embryos develop faster than human embryos. I mean, we take 9 months to develop. What's the gestation period for a pig? Anybody know?
Nope.
Okay,
9
let's
weeks.
let's see if Echo knows.
I know
Is it
it's
9
like
weeks?
5
No.
weeks for a Labradoodle.
Pretty quick. Yeah, it's pretty quick.
Echo, what is the gestation period for a pig?
Here is an answer from an Alexa Answers contributor that I translated. The gestation period for a pig is 114 days on average.
Well, that's longer than I thought.
Mm-hmm.
So it's about 114
months.
days. So
4 months.
Is that right? Yeah,
Yeah.
30, yeah, right, something like that. Yeah, because 120 days would be 4
Roughly,
months, right? So it develops about twice as fast. So those cells will overtake the human cells. That's probably a good thing because you don't want to deliver one of these things. Because God knows, I've seen I Am Legend and other movies like that. Or Alien 3, where the alien came from a dog.
Oh goodness.
And then the other thing is that are some people going to say, oh well, this is human and you're killing it, and it's like no, you should see this as an abomination, and therefore okay to kill and harvest its organs. Mm-hmm. Those people, who I'm talking about. So I think, this is very, very interesting. It really would be better if we could just grow human kidneys in the lab, just in a vat, that way, artificial blood supply, and grow them that way. But I guess that's a long way off. We just don't have the way to 3D print them and then animate them. If you could 3D print the tissue scaffolding and then populate it with stem cells that you didn't harvest from a fetus, because that's where everybody freaks out.
Yep.
We can create stem cells without using fetal cells now. So, and then have them go in and somehow figure out how to make the tubules and make a functioning kidney. That would be the greatest thing, because then we wouldn't have to worry about organ donation. People with brain dead children wouldn't be, having to talk to the organ donation people about, harvesting organs and stuff like that. I think organ donation is a really noble thing, and we should all say yes to that, but it is always born from tragedy. It's a brain death or a brain dead person is really the only ones that can donate live organs, either that or a thing called donation after cardiac death. And what that is where you take the person into the operating room while they're still, quote unquote, alive. They haven't quite become brain dead yet. And then you wait until they die, and then someone pronounces them, and then they revive them enough so that they can get the organs out in one piece. And I mean, the whole process, I think everyone, including the donor services, would say, yes, we would prefer it if we could just pull these things off the shelf.
Yes.
And we'll have it someday. This is another step in that direction. Mm-hmm. You got anything else on that? That's really interesting.
I do not have anything else on that, but I do have a topic 2.
Topic number 2. Yay.
After treatment with semaglutide, people with newly diagnosed type 1 diabetes needed little or no insulin.
What?
In people with diabetes, there are issues with how the body turns food into energy.
Yeah.
This is just a little background.
Yeah, no, thank you.
Sure.
I know. I'm not saying anything. Jesus
No,
Christ.
good.
Uh-oh.
You're fine.
Keep going.
Which is released by the pancreas to regulate how the body's cells turn to blood into
Damn
sugar.
it, that was spam. I should have answered it.
Is either ineffective or produced in insufficient quantities in a person with diabetes. There are 3 types. Type 1, you can get it at any age and is treated with injectable insulin. Type 2, prevented through lifestyle changes and responds to semaglutides and gestational diabetes, which develops in some pregnant women. Type 1 has been treated with insulin injections ever since insulin was first isolated in a lab in 1921. It is effective, but it requires daily treatment in order to be effective. Semaglutides are effective at treating type 2 diabetes along with providing weight loss management, which is all the rage now, and you can't get it anymore if you are not diabetic. And if you are getting it, please
Just shut
email
up.
Steve.
Oh, yeah. And well, just keep your mouth shut.
They haven't typically been prescribed to
Shut your
treat
dirty
type
mouth.
1 diabetes.
Right. As
Okay.
a matter of fact, there's always a warning that says this is not for treatment in type
Exactly.
1 diabetes.
So I don't know if you're going to find that this is
No, I think this is really interesting. What,
well, it is interesting, but I don't know if it's a legitimate study for you.
what do you mean? Yeah.
It does come
I'm
from
looking at
Medical
it.
News Today, though.
Well, that's not where the study was. It was New England Journal
No,
of Medicine.
That's where I got the information from.
Yeah.
Thank you very much. Dr. Paresh Dandona, the study's senior author and a professor of the Department of Medicine and former chief of the Division of Endocrinology in the Jacobs School of Medicine. I felt it was important to say his,
Yep.
what he was. Told Medical News Today that researchers wanted to explore how people with type 1 diabetes responded to semaglutide.
Do they know how this works? Because this is outstanding. Now, what I've got, this is in the New England Journal, but it's correspondence. So it was a small case series, semaglutide after the diagnosis of type 1 diabetes, which is insulin-dependent diabetes, led to elimination of insulin with meals in all patients, and basal insulin, in other words, where they give themselves the long-acting insulin, in most, along with improved glycemic control. What in the hell?
Yeah, because
But it's
people
gotta be
believe
early.
that
Yeah,
there
go.
is no insulin reserve in a patient with type 1 diabetes.
Obviously incorrect, if this is true.
And that's how it's been practiced since 1922, maybe time for a change. We discovered about 4 years ago from other studies that all new diagnosed cases of type 1 diabetes have 50% of their insulin reserve still intact. Wow. The study was composed of 10 people, all of whom had been diagnosed with type 1 diabetes in the past 3 to 6 months.
This is basically a proof of concept study.
Over a period of time, their semaglutide dosage was steadily increased as they were weaned off their usual insulin shots. Within 3 months, researchers reported none of the participants required mealtime insulin doses, and within 6 months, 7 of the 10 participants no longer needed basal background insulin.
Right. Okay, so this is what, if I had a kid and they were diagnosed with type 1 diabetes yesterday, I would absolutely get them into a study. I'm looking it up on clinicaltrials.gov right now, semaglutide and type 1 diabetes, and we'll do all studies. This is, okay, there are quite a few places that are recruiting right now. Type 1 diabetes impacts of semaglutide on cardiovascular outcomes. Okay, adjunct semaglutide treatment in type 1. Randomized trial of semaglutide for diabetic kidney disease in type 1. We want to find the one where the weekly subcutaneous semaglutide as adjunct to closed-loop therapy in type 1 diabetes. There's a bunch of studies, 21 studies that are active on clinicaltrials.gov. So what you do is you talk to your endocrinologist, bring that thing in and say, I want to try this.
Yes. Yeah.
And if they need to get them into a clinical trial, I would absolutely do that. This is stunning enough that it's worth pursuing, even though we don't have double-blind placebo-controlled data. We don't have a sufficient number of people who have been in these trials. But if you can turn this around for a kid, then you don't end up with P.A. John, who has had diabetes type 1 his whole life on an insulin pump and is, at risk for heart attack, stroke, kidney disease, retinal disease. Your dad was another one. Now, your dad was a little different. He was type 2 who turned into a type 1. He went so long that he ended up having to have insulin, even though he was type 2 diabetic, and we became insulin dependent.
So there's more information here on understanding semaglutides.
This is outstanding. Yeah, go ahead.
And how
Yeah.
these medications are not only helpful with people with type 2 diabetes, but also aiding in weight loss. However, the weight loss is more concentrated in lean muscle rather than fat. So it's very important for all these people who are still getting it. Listen here. To counsel them on strength training, weight training, and regularly exercising, because otherwise you're going to get skinny fat.
Yeah.
Skinny fat is no good. Once you lose weight, up to 40% of that could be muscle loss, and that's very hard to get back, especially as you get older.
That's wild.
So they
weird
talk
wild
about
stuff.
how semaglutide is currently only approved for type 2 diabetes, and therefore
And every ad you see, they will say, not for use in type 1 diabetes.
yes, and not covered by insurance companies for type 1 diabetes.
But if you can get into clinical trial, they'll pay for it.
But it could represent a big change in quality of life for patients with type 1.
Wouldn't it be wonderful?
Instead of 3 shots a day, you get 1 shot a week.
We've been looking for a stem cell transplant for type 1 diabetics for all this time, trying to figure out a way that we can just get their pancreases to make insulin again, or an artificial pancreas, all this thing. Wouldn't it be wild if
It's
this
just a
drug and all you got to do is just give it to them early enough and they never have to, whatever the process was that was killing the, as Dr. Scott calls them, islet cells. We in the United States call them islet cells.
Yes.
Whatever is killing those, this stuff actually just stops it, and then they
hell, Steve,
regenerate.
it would be wild if they could produce enough for the people who need it right now.
True.
That'd be
So
great.
I know it sounds like science fiction, but they're going to expand the study to make a multi-center study
Well,
for
you
a
have to.
prolonged period
Right,
of
right, right.
time.
Yeah, because you don't want it to be a flowers for Algernon type situation where they're okay, and then all of a sudden they regress again. Because that's
So that
what happened.
concludes Tacey's
Well, I'm going to
topics.
give you a bell for that.
Great
Self
job.
a bell.
Great job.
That was a good one.
Good.
I'm excited about that.
Yeah.
I don't get excited about too much of this shit, but that's very
That
exciting.
is pretty awesome.
I've had so many adolescents that just go, fuck it, I'm not doing this, because that's what adolescents do.
Yep.
And it's like, listen, just hang in there. It's coming. And I kind of feel like I gave a few of them a bum answer because some of that was 30 years ago and we're still searching for the answer. But it was always right around the corner. This is really, really interesting if this bears fruit. Now, again, we're talking 10 people, stunning result, unheard of, unprecedented result in those 10 people, but we got to do this right,
Yeah.
So standard treatment, we don't have to do placebo necessarily. That may be with something that's this stunning of a result. Placebo control may not be ethical, so they'll have to decide that. But if this holds up, they'll have to stop the study, switch every control. I don't think they will. They might test them against historical controls because everybody knows how it goes.
Right.
You don't really, with type 1 diabetes, we all kind of know how it goes. These kids present with diabetic ketoacidosis, which is the first time that their pancreas fails and their blood sugar goes crazy. They can't they can't incorporate sugar into their cells anymore, so they start to burn fat, and that's why they get the ketones, and they get sicker than hell because their blood sugar just keeps going up and their electrolytes get messed up and stuff. And then you get them under control with an insulin drip and you send them home on insulin, and then they start sticking their finger and all this stuff. And you get them on an insulin pump eventually, and eventually, although the outcomes are way better now than they were, they end up with complications, et cetera, et cetera. So we all know that's how this goes. We don't really have to do a placebo control, in my opinion, for this particular condition because we've been dealing with it for 100 years like this. So using matched historical controls, I think would be okay. Now, if you want to do it in older people and see if it prevents heart attack and stuff, then I think it's totally fine to use, placebo control because we don't know if it does anything there. But anyway. Anyway, this is, I'll shut up about it. I'm very excited. All right. We had a question about NAD. Was that what it was? With Johnny Long something or other?
Longfeller.
Yeah, he's one of them long fellers, I tell you.
Let's see. Dr. Steve, about
Yes.
the NAD infusions. Maybe you can talk about that a little bit.
Okay, yeah, I know a little bit about nicotinamide. So NAD is nicotinamide adenine dinucleotide. And there is some data that shows that you can preserve cognitive ability, executive functioning through supplementation with NAD precursors. And the one that I take is nicotinamide riboside. Now, Scott, weren't you taking a nicotinamide at one point?
Mm-hmm. Yes, I still do.
You still do?
Yep.
Are you taking the nicotinamide riboside, or what are you taking?
Nicotinamide riboside, yes.
Okay. Yeah. You can take niacin, but that stuff, you get the
Red face.
hooty hoo flushes,
Yeah.
and green apple quick step, and all that stuff. But so NAD may have some benefit in age-related cognitive decline. Maybe even there's some data, but looking at Alzheimer's dementia and vascular dementia, but there's also some data on diabetes, stroke, and traumatic brain injury. So it is very interesting. I know that some places are setting up NAD infusions. I'm not aware of data that shows that getting one infusion every month is superior to just taking nicotinamide in a pill form. And I don't have do you have any?
No, but I was going to say, and there I also see where they use it sometimes for drug and alcohol addiction to help with withdrawal symptoms. Yeah, but I think the reason it's obvious, well, I would assume the reason they do it IV is just so it's a lot quicker to the brain, maybe bypasses the blood-brain barrier, unlike a pill, maybe.
Yeah, I don't know about that.
Or maybe because it's more expensive to do an IV therapy than it is to do a oral, than to do a pill at home.
Yeah.
Which would be my guess.
Well, the pills are not that expensive.
That's my point.
Oh, right. Okay,
Yeah,
I see what you're saying.
That's my point.
Yeah, the pills are about 500% less expensive.
Exactly.
But I'm looking at Memorial Sloan Kettering. I just want to see if they've got anything interesting. It's not a schlumpy place. Let me see if they've got anything interesting about nicotinamide. Purported use and benefits to prevent skin cancer. Now, we did talk about that before. A large study found that taking nicotinamide can reduce the risk of getting certain types of skin cancers. And it also may reduce the occurrence of rough, scaly patches.
Ooh.
It's also used as medicine for treating skin conditions such as acne and rosacea. But so far, I don't see a whole lot of anything in here that says any interesting information regarding it versus infusion. But I am a fan of nicotinamide. And if you're at risk for certain skin cancers, I would certainly take it.
Yeah.
It enhances repair of ultraviolet radiation. Radiation-induced DNA damage in human melanocytes, which presumably would reduce the risk of melanoma, which is a shit cancer that can kiss my ass. I'm really putting my neck out there, saying cancer sucks and melanoma can kiss my ass. But anyway, all right, it's well tolerated, so there you go. All right. I'm in favor of it. Don't know that I would pay extra until we find out more about whether it. Do you hear that? Whose mic is that?
I think it's a glass of wine.
No, that's your mic. You hear that?
I do.
Did you hear that?
Mm-hmm.
Okay.
I'm breathing into mine right now.
No, breathing is fine. I don't care about breathing. I can't deal with that noise. You hear it? Move your mic around.
It might be mine. Steve.
No, it's not. It was his.
Way to go, Scott.
I
hang
know.
on,
I
hang
fucked
on,
it up
hang on,
again.
Okay, I'm going to have to rewire all of those. Okay, let me run back. Because we've been getting some weird electronic noise in our some of our feeds, and I got to do something about that. You know, if we do move to your place, we'll just rewire everything, and I'll just get all new cables and stuff. Yeah. Why is it still doing that? Oh, I see. Okay, hang on. Here we go. More about whether the IV is somehow superior to taking the pill. Okay?
Sounds good.
All right. What else you got? We
Nothing.
good? Okay. All right. Is that all from there? Okay.
That's all.
To
Back
the
in
year
time.
2024.
I hope that person's still alive.
I know. Here we go. This is from 2024. Area code 614.
Hey, Dr. Steve, this is Jeff in Ohio.
Hey, Jeff.
I had a question. Someone in my gym told me that if you drink diet soda, the sweet taste on your tongue causes your body to release insulin, and because you're releasing insulin...
Hear that again?
Mm-hmm.
It's your mic. So just switch for the other one for now.
Okay.
Damn it.
Thanks.
Try to not break it.
No, we're trying to break it. That's all we're trying to do.
Break the
We're
fuck
trying
out of
to
it.
Break it. That's what we're trying to do. Let's see if we can. Test.
Okay.
Test.
It's fine. God damn it. I thought I had that solved. Okay.
Hey, Dr. Steve, this is Jeff in Ohio. I had a question. Someone in my gym told me that if you drink diet soda, the sweet taste on your tongue causes your body to release insulin, and because you're releasing insulin, you're gaining weight, you're gaining more weight, and you are more likely to eat more sweet foods after that. I just was curious on your opinion.
Did I say 2024? Woody just pointed out this is a phone call from the future. This is from 2014.
14.
If diet soda does actually cause the release of insulin, or artificial sweeteners in general, if they cause the release of insulin.
Yeah, this person was really ahead of the curve, because that's something that really hasn't been fully elucidated until recently, that if you drink something that, because I was always like, oh no, artificial sweeteners are totally fine. If you drink something that tastes sweet to the brain, it's like, okay, there's sweet stuff. Where's my carbs? And when it doesn't get the carbs, then you start to crave them to kind of assuage the hunger, you know, and it probably is from a release of insulin through some other mechanism. So it's pretty interesting. And or it may just be a brain thing, where the brain it just has a mechanism by which it says, here comes some carbs. Wait a minute, where are they? Because I know if I drink something with artificial sweetener in it and I come home, I will just eat popcorn and rice cakes with peanut butter on them and everything until I'm just completely stuffed. What were you going to say, Taste?
I think it's true.
Yeah, I do too. So that seems to be a real thing, and that's from 10 years ago. That's pretty good. Very well done. All right.
Cool.
Here's another one from April 24th, 2014, area code 774.
Hey, Dr. Steve.
Hey, man.
Everybody tells me I got a prostate problem, but I've had every test in the world, and I don't have a prostate problem. What I do have is a muscle that runs right underneath my navel that goes from one hip to the other hip, and it feels like it gets tightened up like a big rubber band, and it makes it hard to pee. And they want to throw me on these Flomax drugs or whatever, and that just ruins my sex life and this and that. I just need some other extended help. Thank you. Call me back, 77.
Oh, okay. Yeah, he wanted me to call him back. Sorry, man. It was 9 years ago. So he has a muscle that is causing difficulty urination. What you got?
Well, I was going to say, he thinks it's a muscle.
Yeah. What do you think it is?
God, difficult. It sounds to me
you
like a
sounded
prostate.
like you had an answer.
No, hell no. I was just like, a muscle that runs from your navel to your hips, not so sure.
Yeah.
But, it sounds like they're treating him for prostatitis, which would be the norm.
Yeah, they wanted to put him on Flomax. If he wants to know.
Yeah, I'm sorry, go ahead.
Well, back then, we didn't have some of the tools we have now. What I would do is I would shove an ultrasound probe up his ass and measure the size of his prostate. And then the other thing you can do is a thing called manometry, where you stick a balloon up your cock hole into your urethra, and then see how much resistance there is to flow from the prostate across to the urethra. And if there's a huge drop off in pressure, then it probably is a prostate problem. But a urologist if you have a problem like this and your primary care is just throwing pills at it, go to a urologist and let them actually, do some studies on you and see. He could have a urethral stricture.
Right.
There's all kinds of stuff.
He could have a herniated disc in his lower back, and that could give him.
Give thyself a bell.
I already got one, Scott, so we're even.
Right. Damn it. Yes.
But
you both have one.
But to be clear, the prostate, having a prostate problem, you're going to have a couple things.
Well, everybody equates inability to pee to having a prostate problem.
But that's not always what it is.
Or what about peeing too often?
Could be, but not always prostate either. Yeah, so
we'll talk about that next.
Yeah, and when you go to your urologist, typically they'll give you a sheet and they'll say fill out these, just 1 to 5. How many times do you urinate at nighttime?
Right.
And typically if it's more than twice, that's an issue. Do you feel like you're going to have an accident before you can void your bladder? In other words, can you get to the bathroom before you pee your pants?
Right.
That's an issue. When you feel like when you've peed or you still feel like you have to pee more. In other words, you can't void your bladder completely.
Right. Or do you have binary flow where you pee and then you have to pee again? Or you pee and it's forceful and then it decreases and then it comes back again. That's binary flow. That is also a sign of prostate issues. Or if you're sitting and pissing in the morning because you read the newspaper on the John or whatever, and then you get up and then you get in the shower and now you have to pee again. That could be another one. That's also called binary flow.
Yeah.
Do you guys work in a way such as women my age have to pee, but we also have to lean forward?
No, you got fucked
to
up
get
anatomy.
the rest of the pee out. I just wondered if you guys have to change positions.
We don't have a vaginal wall that's weak, and so that the bottom of our bladder is dipping down into our vaginas. And
nice.
that pools fluid that causes you to have to lean forward, and that's really more what that is. There is treatment for that, though.
But if your prostate,
is it surgery?
No, it doesn't have to be. This is the one time when we can use estrogen cream to tighten up and thicken the vaginal wall, or you can use a device called a Votiva, which is basically a dildo that has micro needles on it that you shove in and out and turn radio frequency and electricity on, and you go in and out. And what it does is it will tighten up the tissue as well. That is not a procedure that I can do.
Well, what
because
if it
the first
didn't work
time
for
that
you?
I did one where you take an electrified dildo basically, and you go in and out and in and out, in and out and all around. the first time I did that, they'd say that creepy old man assaulted me. In that
Okay, so
office.
creepy old man. What if I have already done that?
Correct.
I'm still having that issue.
Well, how many times did you do it? Because you're supposed to go
The
back and back.
total amount of times that you're supposed to.
Okay, you say that. I don't think that's true. Yeah,
I did.
Well,
you got relief initially, right?
Yeah, I did, but
And
I
then
mean, it's still there. I mean, it's better.
But then you have
I've
to go
been
back.
noticing. I've been having. Well, I'm
Right, exactly.
not fucking paying that. But
There you go.
anyways,
Okay, fair enough.
Well,
what about the cream?
Just
though?
piss yourself.
Let's talk
then.
about
It's totally
the cream.
Fine.
well,
No, the cream.
I can lean forward, Steve. I can
Right.
do that and not piss myself.
Okay. Yeah, you can do the cream. You just talk to your OBGYN about
Okay.
that. Yeah,
Will do.
absolutely. Go ahead.
well, and I was just going to say, but we have a similar thing. If the prostate swells, the prostate swells up into the base of the bladder. The bladder bloops over the prostate.
Correct.
And now we've got the same kind of, a very similar issue with all that. The urine is in a little ring above the prostate inside the bladder.
Right. Yeah, just
So kind of similar.
sloshing around in
Yeah.
a ring.
So what
instead
do
of
you
emptying
do? How do you
completely.
get it out?
Well, that's a whole other thing. You can
Lean forward.
You can lean forward, lean back, and lean
Wiggle around a little bit.
Yeah, but the difference is that it doesn't pull up in one area, so we can't just lean forward because it's kind of in the circumference.
Yeah.
It's around the prostate.
What would be
for the
good
most
is
part.
if you could get on one of those rides where you stand there and it spins around and then it
man,
raises.
like a tilt-a-whirl kind of that. That would do it. That would do
That
it.
would totally.
That
fix
would
your
totally fix it. But for the for this guy, it could be a disc, it could be neurologic, it could be prostate. But there are a lot of tests they can do now that are not
It
as
could be
as painful.
A urethral stricture,
Yep.
where he just has a narrowing of the tube going from the bladder to the outside world. And those are easy to fix, but he needs a urologist. And I'm hoping in the last 9 years that he did that.
Let's hope so.
God.
Oh, this is terrible.
Okay. Oh, wait. Uh-oh. Oops.
Oops.
Hang on.
My wife
What?
has had HPV since we've been married, and it's been 7 years, and I just now started getting warts on my dick. Should I be concerned?
Okay. Now it's been 16 years. So, yeah, you got to get that treated. Unfortunately, certain varieties of HPV can increase your risk of penile cancer, rectal cancer, head and neck cancer and stuff, which is why, listen, there's not anything you can do about it now. Just get one of the lesions tested, see if you're at risk. If you are, listen, knowing you're at risk means you're less likely to die from whatever that thing is. If you know you're at risk for colon cancer, you're going to get your colonoscopies more
Right.
frequently, and you're going to be less likely to die from it.
Right.
So do that, and then vaccinate your kids with the Gardasil or whatever. When you listen to this another 9 years in the future, whatever HPV vaccine there is, those are anti-cancer vaccines. Those are not STD vaccines. Those are vaccines to prevent head and neck cancer, anal rectal cancer, cervical cancer, and penile cancer. Now, all of them suck.
Oh, God.
And to understand that HPV is everywhere.
Yes.
Yes.
Right. It's like 48% of people. If you bone a random person, you've got a significant chance of being exposed to HPV.
Why would you do a crazy thing like that?
If they've ever had an abnormal pap smear, for one. But anyway, all right. Let's see here. Here's God. I don't know what this one is. Okay, this is from April 24th, 2014. I think we'll just keep doing this until we run out of phone calls, which will take quite a
Dr.
while.
Steve, this
Yes.
is David in Augusta, Georgia.
Hey, David.
Dave.
52-year-old lesbian trapped in a man's body.
Fair.
Okay.
Okay.
I
now-
noticed this
now
growth
60.
between my left clavicle and trapezius about midway that I thought was an old people's wart. One of those big round ones that
Okay.
grows a hair, just gets in the way.
Sure,
and
a
it's
skin
an
tag or
annoyance.
something. Yeah.
Then I noticed it became translucent, and I popped it. And out came this irregular white-shaped object about the size of a pea, bright white, very little blood, mostly what I think is serum came out with it.
Yeah.
And I think it was a fibroid. It reminded me of what came out of some ovaries when I was working as a surgical technician, except a whole lot smaller.
Yeah.
Was this indeed a fibroid? And if it was, what was it doing up there around my clavicle?
It's a good question. Any of the cysts that form in the body will turn white, will have a white sort of outer layer. And I'm talking about epidermoid cysts, they'll all be white. So the only way that you would know if this had been a fibroid would have been to take it to a pathologist, have them slice it up and look at it under the microscope. And that would have characteristic cellular thing. But I have taken out, now lipomas are generally yellow and well circumscribed, but I've taken out cysts from people that grew because they had a trauma to the skin. And what happens is if you think about it, your skin sloughs, it's constantly sloughing off. There's layers, and the deepest layers produce the layers on top, and then it keeps producing until they become flattened, keratotic looking. They're hardly even cells, and then they slough off. And this process is just continually happening and regenerating. Well, what happens if you have a puncture wound that drives some of the cells that are creating keratinized dead cells that slough off? Now they can't slough off anymore, but it'll keep producing them. Well, it's going to make a cyst. It's going to make a cyst under the skin, and every once in a while you can, feel one of those, and it feels like a nodule. And if you cut it open, it'll be white, and the junk inside it will be chalky white, sort of looking stuff. It's like compressed cottage
oily
cheese.
Kind of.
Yeah, it's oily. It
crazy.
stinks and it's greasy. And what that is that's just, those are skin cells that never sloughed off.
What if it's hard?
Well, yeah, if it's hard, then it may just be small enough that the thickness of the cyst wall is large compared to whatever's inside it, and that'll make a hard.
It feels
one.
like a little BB or something.
Yeah, yeah.
And yeah, that granulated tissue is kind of like that.
It all has to do with how big the thing is, so that what is the ratio of the thickness of the cyst wall compared to the cyst itself.
The innards.
So I guess I can tell this story. There was a person once that had a big giant one on their back, and it got infected. And when they get infected, they get even bigger. Okay. Now all of a sudden, because when these that was me again. Sorry. When the cells are dividing, they'll get to a certain point where the external pressure will equal the internal pressure. The pressure to grow will be halted by the pressure of the skin overlying it. They can't go any further.
Right.
Well, when it gets infected, all of a sudden, it's like going when the sun starts burning carbon instead of hydrogen. It's so much hotter, and it'll blow up and the sun will become a red giant, right? Like Beetlejuice. So these things will do the same. When they get infected, that pressure will increase, and now they can become much, much bigger. But now it'll be all kind of fluctuant. And if it's on somebody's back and it's really tight, and then you go and take a number 11 scalpel, which is the triangular sharp one, and you stick a hole in that to relieve the pressure, and it's under enough pressure that it starts shooting out pus, infected fluid, basically, and and it's all broken down. It was sort of cheesy stuff. Now it's just fluid because of all the bacteria have just been eating it, and it stinks. And when that happens, it happens so quickly, you're surprised. And what do you do when you're surprised? You go, ah, like that, and you open your mouth in surprise, and all this stuff goes shooting into your mouth and covers up your glasses. And now you got a mouthful of somebody else's pus. Your glasses are completely covered. You can't see anything. And now you can't stop. You got to keep going. Yeah. You can't just stop. You can't
But
turn around and
nowadays,
puke.
you'd have a mask on.
Nowadays, I would have a mask and a shield. I did every other time after that because I was pretty green when this happened.
Oh, gosh.
And that only has to happen to you once.
Yep.
And once.
Yep, there's plenty.
But anyway, Now, when that happens, then you end up with a big cavity, and you got to jam it full of this stuff called iodoform. But I don't. Anyway, it's yeah. So that one was fluctuant because the ratio of the size of the cyst to the thickness of the cyst wall was very great, and it the closer to 1 it gets, the harder and less elastic those things will be. Okie doke.
Cool.
All right, so I think that's probably what that was. If you express something from your body and you don't know what it is, you can always just stick it in saline or oil, even like put it in a jar and you can pour oil over it
or something.
Yeah, just to preserve it and take it and have a pathologist look at it under the microscope. All right, okie doke. Same guy. Nope. Okay. Here we go. Here's one from April 26, 2014. I'm sorry, y'all. I don't know how this happened.
Dr. Steve.
Hey.
Last week on the O&A show, they were talking about can the body and brain smell piss during a dream.
Okay, I can't understand what he's saying, so I'm going to move on. Sorry, man. You waited 9 years for that.
You want to just
What?
rewind it?
No, I couldn't understand him, so I think it was his audio.
Good Dr. Steve. My name is Mac from Maryland. And I'm a disabled back, so I've been dealing with back issues for quite a while.
Thanks for your service, too, man.
Yeah,
And recently I've been having pain and shooting down my leg. I get the static pain.
Yep.
It's caused my foot, it's caused my calf to go really, really tight, and then my foot to go numb.
Okay.
Now, I've been going to the VA Medical Center. They've been giving me, they prescribed me Gabapentin.
Yeah.
I don't know. I looked it up. It says it was for some nerve stuff.
Yeah, we use it every day now. Back then, it was not so
They said,
common.
hey, take that for a while and it should get better. But my wife's been trying to convince me to go to, what is it, the Philadelphia Spinal Laser Center.
Oh, that's a place I almost went to. I know exactly what he's talking about. So here's the thing, and Dr. Scott can talk about this some, and we've got, I don't know, we got about 2 minutes left. If you have a slip disc or whatever, a herniated disc in your back, or if you've got spondylolisthesis where the bones are not lining up properly, whatever it is, and it causes pain that runs down your leg, that we will often call that sciatica, but it's really lumbar radiculopathy is the correct term for that. But if it is accompanied by neurologic deficit, in other words, a floppy foot, or you can't piss,
feel.
Right. Okay. Go ahead. You.
But you're right. But that's the big red flags for sciatica. If number one, if you lose sensory function,
right?
So you can't feel your leg, you can't feel your foot, you get numbness that doesn't resolve when you change positions,
right?
Or you lose control of your bladder, you lose control of your bowels. Those are surgical emergencies.
That is correct.
Yeah,
that is an occasion to go get that shit looked at ASAP.
Right.
And sometimes it will be surgery. Now, the surgery that they were doing at that place, they're still doing it, is sort of a novel surgery where rather than putting in a cage, they have stabilizers that go in and they open up the parts of the but I'm trying to do this in lay terms. Parts of the vertebral body that are causing the pressure, they'll cut those out, but it makes it unstable.
Right.
So they put this thing in that is not a cage; it's not fixed, and what it actually does is allow you to still bend your back, and it's a really neat surgery. I considered doing it when I was in my extremis, which thank the good Lord above that I have a really good physical medicine and rehab provider that knew what the hell they were doing and got in there with the right kind of needle, the right kind of medicine. I can basically do anything right now. I could go to Disney and walk 10 miles, I'm convinced right now, and not even think about it.
Yeah.
And then see people like Dr. Scott. Dr. Scott works with pain management people that do the same kind of
every day
things. And you can do this without surgery, without opioids. But there are some cases where you just got to go do the surgery.
Yes. Sensory loss, motor loss. In other words,
Yep.
if now you can't move your foot, or like you said,
Right.
you know,
Foot drop.
foot drop. Anytime any major changes like that. But if it's not that, and sciatica can be like you said, actually the lumbar radiculopathy, which is we would call a discogenic sciatica.
Right.
And the other kind of sciatica is a piriformis syndrome.
Piriformis.
So
Yeah,
you have a
very
muscle
good.
actually
Okay,
spasming.
I'm going to have to give him a bell.
A bell. Give thyself a bell.
Two. So,
Suck it.
yeah,
Right.
But,
So
but-
piriformis syndrome.
Yeah, so that's a muscle that's actually spasming around the sciatica. So it gives you almost the exact same signs and symptoms, the same problems with the pain and misery, but it's actually from a muscle, not your spine.
And you can treat that yourself with stretches at home.
And you know, acupuncture needles work real well.
Yeah,
Ice can help.
of course.
You know, heat can help. Sure. I mean,
But
all
if
these things can.
you think you might have that, Google piriformis syndrome,
yep.
and there are videos out there that'll show you the exercises. to do.
He just got that bell because he was paying attention
awesome.
and not to the heat that we're currently enduring.
Well, that's right. It's amazing how not hot it is outside, and it got really hot up
That's
here.
crazy. Yep.
I look
All right,
forward
good.
to moving the studio to your place, Scott. I think that's
Yes.
probably what we need to
I'm
do.
not driving there because I'm going to be drinking.
Thanks to everyone at SiriusXM who steadfast supported the show, sustained us over the years, particularly Lewis Johnson, Jim McClure, Sam Roberts, James Norton, Travis Tepp, Troy Hinson, Paul Ovcharsky, and Roland Campos. Go to our website at drsteve.com. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
My God, it's so...
All right. We'll just, I think Tacey's in favor of just ending the show there.
I am.
Well, we've got
Unless you've got a question.
You have a question from
No,
the
we don't have
Fluid
any.
family? Okay.
They're hot too?
They're hot
Okay.
too, baby.
Yeah, okay. Well, hang on.
Hey, Kush.
Hey, Kush.
What's
is here.
up?
What's up?
Okay, here we go. Okay, well, let's get out of here. Thanks always go to Dr. Scott and Tacey. Thanks everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand, other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Don't listen to my niece, Holly. Quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thank you. All right. Okay, let's go do the opening. We'll do it real quick, and then we'll get you out of here, Taste.
So, this is the hottest it's been.
All right. I don't know why. It's not hot out.
Bizarre. It is bizarre. I think it's late in the day.
Well, I think it's also that someone didn't turn on the air conditioning, and that someone was me. So,
Doofus
all right,
head.
here we go. Okay, shut the fuck up.
You are one pathetic loser.
I am too smart. I am too smart. I am too smart. I am too smart. S-M-R-T.
You see? You're stupid minds. Stupid.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain now and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my wife, Tacey, my partner in all things. Hello, Tacey.
Hello.
This is a show for people who had never listened to a medical show on the radio or the internet. We ascribe to the Tukey World Order, T.W.O. If you have a question that you're embarrassed to take to your regular medical provider,
Steve
or if you don't
does.
find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your health care provider. Please don't forget stuff.drsteve.com. That's stuff.drsteve.com for all of your online shopping needs. Scroll down and get a roadie for the stringed instrument player in your family. Or you can go to roadie, ROADIE.drsteve.com, and there's apparently some discount there. Check out simplyherbals.net. That's simplyherbals.net, Dr. Scott's website. Tacey and I do a Patreon, patreon.com/weird medicine. While I'm on my wellness retreat, I'm going to maybe think about doing a Patreon every night.
Nope.
Why not?
Because that's not a wellness retreat.
Yes, it is.
No, it
no
isn't.
devices.
Why isn't it?
No devices.
Fuck off.
Except for when your wife calls
Oh,
about
okay.
the
Oh, yeah,
fucking
there you
internet.
go.
Fuck both of you. Eat my ass.
It's either you or Scott.
Oh, you're not supposed to curse in the
Somebody's
last
getting
first
called.
2 minutes of your show without getting.
Well, you did it.
Oh, I did it. Well, you made me. And check out cameo.com/weird medicine. I will do cameos from there because that's relaxing. I will do cameos. So cameo.com/weird medicine. $5.
Please send Tacey money.
It's half of what Tukey.
Because I've got to eat.
Yes,
it's half of what Tukey charges.
And I'm going to have to,
Oh yeah, you're gonna
like,
cry
damn.
poor now.
Go.
What do you call it? DoorDash and shit.
Yeah,
Yeah, that's true.
poor old Taste.
The old taster.
Poor old Taste.
And what if the
get-
Wi-Fi goes out?
Well, then you're screwed.
Oh, for fuck's sake.
Yeah, then you're screwed.
Well, anyway.
Screwed girl. Screwed girl,
This
happy
is what
husband.
I'm going to be doing the whole time.
I love to masturbate.
Yeah.
I love to masturbate.
Well, I hope you get your money's worth.
Yes.
All right. Okay, you're excused.
Thanks, Dace. Good topics.
And it's 9/12/23.
Yep.
Okay. All right. Yeah, it is ridiculous. You know what? I think maybe the fan actually makes a difference.
Oh, I think it does. Yes. Much less of a combative attitudes.
Yeah. Tacey was really
Combative. She's combative.
I am a little combative when I'm hot.
Yeah.
Well, when you've been working all day. When you've been working all
must
day.
be hot all the time.
They said, this is your room.
Yeah.
Last time I worked, they said, this is your room, and they went back and re-fucking did the whole thing, and I was like, motherfucker.
Oh, no, did they really?
Fuck am I here?
Bunch of bastards.
But today they were like, you didn't do this by yourself.
Oh, really? So they're impressed by your work ethic. If they only knew how truly talented you are. Don't show too much too early.
All right, what do you want to play? Wait, where are you? Are you plugged in?
This is my acoustic. I brought an acoustic. I mean, it can be.
It doesn't have levers on it?
Yeah, it can be electric. Yep.
Okay, well, no, it's fine. I'll just use the other mic.
Yeah. What's easy? Whatever's easiest.
The far mic.
Yeah.
Okay.
Tasty's up.
All right. Yeah, turn it
Yeah,
on.
here
That's
you go.
fine. Oh, it sounds good. Hey, I want to try something.
I'm ready. I was ready.
Hang on.
Hick says we should play Hot Blooded because of Tasty.
Yeah. Jesus. All right.
At least she's
Okay. Today I went and
Oh, yeah.
fired up my camera.
Oh, yeah.
Yeah, I opened up a pack of Coors. Everyone knows I only drink to hydrate. Go, how stupid can one man get?
I will love it. Hang on, I'll join you.
I doxed myself and Carl down in Florida. I burned my bridge with Kevin, Hal, and Chad. I don't understand how green screens work. Hey, how stupid
Can one man get?
I raised a couple $100 for some chemo. Beloved chatters, husband had big C. I transferred a check and then a Venmo. Hey, how stupid can one man be? Went on Artie's show and made some off-color jokes and told old Dan Filato dump the vids. Whenever someone else makes me so angry, I accuse them of making fun of my kids. Whoops. Yeah, oh yeah, how stupid can one man get? Yeah, how stupid can one man be? That's almost there.
That was nice. So you were playing it in the original tuning. So you did that C.
Oh, okay.
Yeah, that's okay. That's why I lost you for a minute.
Okay.
So you're playing. So yeah, you're playing CF.
No, I'll play. What key you want me to play?
Well, no, it was. We usually do it in E.
Oh, okay.
When John
Okay.
sings it.
Oh, I can do it in E.
Today I walked down the street I used to wander. Yeah, shook my head, made myself a bed. Had many things that I still remember. Hey, how lucky can one man get? I bronzed my shoes, hung from a rearview mirror, bronzed admiration.
Wait a second.
Blind
Hang
spot
on.
of. Oh, sorry, buddy.
No, you're
but,
fine.
But that's the you sing it. You got the tune. I'd rather you do it. I'll just back you
I'll
up.
sing it.
No, we're already at it.
Today I went and fired up my camera, yeah. Opened up a pack of Coors. Everyone knows I only drink to hydrate. Go, how stupid can one man get? Doxed myself and Carl down in Florida. I burned my bridge with Kevin, Al, and Chad. I don't understand how green screens work. Yay, how stupid can one man get? No. No, you can't. Listen, you can't just hit any note and then try to raise it up to the right.
That's what you do. I brought you back to an E, you bastard. You should have been
raised
singing.
a couple
There you go.
$100
There
for
you
some
go.
chemo. A beloved chatters, husband had big C. I transferred a check and then some cash in Venmo. Hey, how stupid can one man be? I went on Artie's show and made some bad jokes and told Dan Filato to dump the vids. Whenever someone else makes me so angry, yeah, I accuse them of making fun of my kids. Yeah, wait.
Yeah.
They're making fun of my kids. Yes. Today I went and fired up my camera. Yeah, I opened up a pack of Coors. Everyone knows I only drink to hydrate. Skull, how stupid can one man get?
Hey,
how stupid can one man get? Hey, how stupid
can one man get?
No. Okay, that's close to being where it should be. I don't think there's any dabblers in the thing, so.
I love it. That sounded good, man.
That's for the dabblers.
There you go. The dabblers.
It's a long story.
That is a great thing. Yeah, it's a long story. But it did sound good.
All right, what else you want to do?
That was sounding good, Steve. I like it. You and we need to do more where you sing.
No.
Yeah.
I would like to do that Brent Denon song, though.
Which one is it? We got time for one more, then we got to go make some food.
The one, why is everything this way, or whatever it is? Ain't no reason.
Oh, that's right. Ain't no reason. Oh, yeah. That's silly.
We got to play it with the song once, but there ain't no.
Now, hang on. What key you playing in?
Whatever you want.
Oh hell no! You sing it. You sing it. You get to pick it.
Preachers on the podium speaking the saints, prophets on the sidewalk begging for change. Ladies laughing from the fire escape, cursing my name. Got a basket full of lemons, they all taste the same. A window and a pigeon with a broken wing. You could spend your whole life working for something just to have it taken away. Anyway, I'll work on that one. I do want to learn that one. Love will come set me free.
Oh. So this is a right, right?
Love will come set me free. I do believe. Anyway, all right. What do you want to do? I'll work on that.
Yeah, I was trying to find that Brent Denon song, and hell, can't find it, of course.
It's called "Ain't No Reason" official.
Ain't no reason. Oh, here we go. Okay, official.
We got you and I got to practice it with the. I don't want to play that one and just learn it in front of people, because then we'll ruin it for people. Because it's actually a really good song.
I was saying, how is that different than anything else I ever sing? Not at all.
All right, quick! People are losing interest.
Are we doing? We doing it in a C?
No, we'll do a different song. What's
yeah. Okay, let's do one we know then. Well, all right, let's do one more, Dr. Steve, and we'll get out here. How about how's about? Let's go back to Let's do. You gonna do it 24 frames again? The whistling song? Okay.
No, I just did that one.
Okay, let's do. I can't remember.
Just anything.
Yeah, well, hell, I'm trying to find something. Goddamn, if I get it, you'll be like, "Whoa, we did that. That's terrible." I can't win.
Yes, you can. Just
I can't.
Pick a song.
I can't. All right, here we go. We're gonna do. We may have to go back to the original. Come on, baby. Come to Papa. Oh, yeah, we should do.
Okay, what? What do you got?
Let's do. Let's do this. Hey, if you want to pick one, you fucking pick it. I'll play whatever you want to play. I'm just trying to find something you'll like.
No, I don't care.
Let's do.
Just play anything.
Let's do. How about
Do you have our playlist?
Yeah, that's what I was looking through right now. I'm trying to find
Pick one at random.
Okay. One at random. Here we go. How about "Come Monday" from Jimmy Buffett?
Okay. Don't
Come
know
Monday.
that one, but I'll do it. Have we ever played that? Nope.
At some point in time.
You're full of shit.
It's in.
That's fine. Which version are you using?
Let's do version.
I'm doing version 4.
Version 4, yep.
Okay.
Let's do 2. Heading up to San Francisco. Let's do it in G. You ready?
Yeah.
Let's do it in G. Yep. So 3, 2, 1, and heading up to San Francisco for the Labor Day weekend show. I've got my hush puppies on. I guess I never was meant to play the rock and roll. Honey, I didn't know that I'd be missing you so. But come Monday, it'll be alright. Come Monday, I'll be holding you tight. I've spent 4 lonely days in a brown early haze, and I just want you back by my side.
This is a Buffett song?
Yep. Yes, it's been quite a summer. Rent-a-cars and westbound trains. And now you're off on vacation, something that you try to explain. Darling, I love you so. That's the reason I just let you go. But come Monday, it'll be alright. Come Monday, I'll be holding you tight. I've spent 4 lonely days in a brown early haze, and I just want you back by my side. And this is where it changes just a little bit. A minor. I can't help it, honey. You're that much a part of me now. Remember that night in Montana when we said there'd be no room for doubt. I hope you're enjoying the scenery. I know it's pretty up there. We could go hiking on Tuesday. With you I'd walk anywhere. California has worn me quite thin. I just can't wait to see you again. Oh, come on, dear, it'll be alright. Come on, dear, I'll be holding you tight. I've spent 4 lonely days in a brown early haze, and I just want you back by my side. I spent 4 lonely days in a brown early haze, and I just want you back by my side. That F at the very end.
Yeah.
That's what sounds kind of funny.
Yeah,
because I know you thought I was way off.
No. I know the song, and so I just I couldn't. I was off on the music. So let's do the last thing. Come Monday, 2, 3, 4.
Come Monday, it'll be alright. Come Monday, I'll be holding you tight. I've spent 4 lonely days in a brown early haze, and I just want you back by my side. I spent 4 lonely days in a brown early haze, and I just want you back by my side.
There's a Beatles song that ends like that.
Hey, thanks, Kush. I brought my Gobin acoustic today. I don't know if you can see it or not. It's a nice little guitar.
Okay, now I know the song. We could actually do it.
No, do it one more time. Let's do the middle part. A major, 7.
Yeah.
D.
Yeah, I read that right.
Yeah,
I thought it was
okay.
an A minor 7 when I first read it.
I can't help it, honey. You're that much a part of me now. Remember that night in Montana when we said there'd be no room for doubt. So let's go back to let's just go back to the Come Monday just above that, and then we'll go real slow through the A minor stuff. Okay. Come Monday, it'll be alright. Come Monday, I'll be holding you tight. I've spent 4 lonely days in a brown early haze, and I just want you back by my side. I can't help it, honey. You're that much a part of me now. Remember that night in Montana when we said there'd be no room for doubt. And this is when it goes kind of a...
So he does no room for doubt, and actually on the D.
Yeah, down, and then it goes... And then it resolves back to the... I hope you're enjoying...
Okay, I still don't understand.
Yep.
To play the chords, don't play the notes.
Oh,
so I know how it's supposed to go.
Okay, so let's... We said there'd be no room for doubt.
Okay, I got it. Okay.
Yep.
Let's do Come Monday.
Okay.
We'll go all the way through.
See.
2, 3, 4.
Come Monday, it'll be alright. Come Monday, I'll be holding you tight. I've spent 4 lonely days in a brown early haze, and I just want you back by my side. I can't help it, honey. You're that much a part of me now. Remember that night in Montana when we said there'd be no room for doubt. I hope you're enjoying the scenery. I know that it's pretty up there. We can go hiking on Tuesday. With you I'd walk anywhere. California has worn me quite thin. I just can't wait to see you again. Oh, come Monday, it'll be alright. Come Monday, I'll be holding you tight. I've spent 4 lonely days in a brown dirty haze, and I just want you back by my side. I spent 4 lonely days in a brown dirty haze, and I just want you back by my side.
You know, I don't think I ever realized that was Jimmy Buffett.
Yeah, it's a great little song.
That was like Hall & Oates or something.
I love that song. It's a great song.
That's a good song.
So
yeah.
he wrote that about his wife when he first met his wife.
Oh.
The very first minute he met her, he wrote this beautiful song. And Steve, the transition, it's just so much easier. That A major 7 C and an F. I hope you enjoy the scenery. Yeah, so I just have to practice that. I can't help it, honey. That much a part of me now. Remember that night in Montana when we said there'd be no room for doubt. I hope you're enjoying the scenery. I know that it's pretty up there. We can go hiking on Tuesday. With you I'd walk anywhere. California has worn me quite thin. I can't wait to see you again, Lord, come Monday, it'll be alright. Come Monday, I'll be holding you tight. I'll spend 4 lonely days in the brown dirty haze, and I just want you back by my side. I'll spend 4 lonely days in the brown dirty haze, and I just want you back by my side. There you go.
Yeah, okay.
Yeah, I like it.
Yeah,
well, thank you.
Add that to the list.
Thank you. Yeah, I really like that song. That was more fun than I remembered.
All right.
That's got a good tune, doesn't it, though?
It does. Thanks, everybody. Tukey does roll.
Hey, when you taking off? Saturday?
No, well, I'm going to Detroit Thursday.
This Thursday?
Yep.
Oh, shoot.
Going to hang out with Cardiff and Bedabbler and
Sean Pay.
Yeah, Carissa's going.
Oh, that's right. C is going. I forgot about that.
And then
you back?
And then I'll be back Saturday.
Saturday night, right?
Yeah, Saturday afternoon.
Yeah.
I mean, if you want to get together and play, that's got to be dealt with. Hang on. Hello.
Yeah,
Where is that coming from? Oh, I see. It's when I do that, it's pushing on this. That's what that is. Okay, I gotta fix that. All right, good. All right. Thanks, everybody. You're a bunch of kids. Watch for Myrtle live streaming from WATP Detroit with Tukey.
You got saved, big boy?
Huh?
You save it? I mean, I know you know what you're doing.
No, I don't know what I'm doing.
Fucking do it. As busy as